couldn't believe it. I thought that was the death sentence.
I needed to accept the fact that my daughter would live in a wheelchair for the rest of her life.
I told her that she was in God's hands.
How am I going to go to my best friend's funeral?
It brought me to my knees, and I said, I cannot live without him.
Next, two medical mysteries that defied the experts. Fireman EMT Steve Derrig had saved hundreds of lives, but desperately ill with no diagnosis. Could he save his own?
I felt like I was just hanging on the edge of that cliff, and once I let go, it was just going to be over.
Marissa Irwin was a beautiful, happy little girl, but by age 15, she was racked with pain and told she would never walk again. Her only hope was a mother who wouldn't give up.
I couldn't worry about what the doctor said. I knew there was something wrong.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. Steve Derrig had always dreamed of becoming a fireman, and at age 24, that dream came true.
Oh, Steve's a great guy. He's a fun guy, the type of guy that is just easy to be around. He was the type of fireman that all of us sort of strive to be.
He always said he tried to treat his patients like he would treat his own parents.
I think my favorite part of the job was the camaraderie. It was fun, it was rewarding, it was an experience I would never want to replace.
How many people get to ride on a fire truck? And we get paid for it, so that's pretty special.
But in October of 1999, Steve's dream life began to darken.
When I first started not feeling well, it came on gradually. I'd try to take it in a deep breath and was just unable to do that.
At first, I thought that possibly he could have inhaled something that's causing him not to be able to take this full breath of air.
At the time, too, Steve was doing some remodeling in his basement, a lot of dust and whatnot. He thought at one time that he just got exposed too much to that.
Steve hoped his breathing problem would resolve itself, but a month later, he was getting worse.
After a while of me riding him and it getting a little progressively worse, he promised me that after the holidays he would go and see his family physician if it didn't clear up.
So I made an appointment, and he listened to my lungs, vital signs, and he decided that I had pleurisy.
Pleurisy is an easily treatable inflammation of the lungs. It is most commonly caused by viral or bacterial infections. Treatments vary, but in Steve's case, he was prescribed steroids to reduce the inflammation.
So we started him on prednisone, and we thought that it would clear up within a week or so.
When I first heard that Steve might have pleurisy, I actually thought, well, good, because I thought this is something we can deal with, this will be easy.
But by the end of the week, I found that not only was I not any better, but I was in fact getting worse. When I went back in to see the doctor, he still thought it was pleurisy, did a chest x-ray. Chest x-ray came back negative, and he just increased the prednisone that I was taking. Said this should knock it out and I should be fine.
Being a firefighter and a paramedic, he is very level-headed and very easygoing, and I just don't think that at the time he was overly concerned.
Over a period of few days, I continued to take the prednisone, and the symptoms were the same, but were gradually getting worse. I went to see the physician again. He was a little more concerned. He said, I agree, there's something going on. You look sick to me. I'm gonna send you down to the hospital, and we will run some more extensive tests and get to the bottom of it.
At the end of January, still struggling to catch his breath, Steve checked into the hospital.
They began a series of tests, chest x-rays. Again, everything was coming back normal. On the second day that I was in the hospital, a pulmonologist came in to see me, and at that point, he had determined that I had asthma.
The asthma diagnosis was a little bit shocking because Steve never had any problems with breathing.
He said it could have been something as simple as something that I breathed in during a fire, and he prescribed some inhalers, and again thought that if I followed this course of treatment, the asthma would be resolved.
Not that we're doctors, but we've seen a lot of asthma patients, and Steve's signs and symptoms really did not present as asthma.
At this point, I'd been taking the prednisone for approximately 3 to 4 weeks, and I was having some side effects. It was making my face start to swell. And a couple guys, they would come in the station and laugh. Thought my head looked like a basketball.
Steve's a small guy to begin with, and I've always been heavier than he was, so I used to joke with, hey, you know, it's about time you're getting fat like me now.
Soon, the side effects of the steroids began to affect his job.
While I was on the ambulance, I could tell my hands were a little jittery and I was having a hard time doing small tasks.
It just didn't seem like any of the medications that they were prescribing were doing their job.
I remember telling her, when I die, I just want you to put on my tombstone, I don't know what was wrong, but it wasn't asthma.
Neither one of us were really looking the other in the eye and saying, I'm scared to death.
But according to the Derricks, Steve's doctors did not appear to be concerned.
The doctor kept urging him to take the prednisone and slowly over time kept bumping up the dosage.
And he changed my inhalers and again said, I feel like this is the proper treatment. It's just going to take a little bit of time and you should be feeling better.
Desperate to get well, Steve took his medication faithfully. But soon his breathing had become so bad, he couldn't even perform simple chores without gasping for air.
Every time Steve went up the stairs, he was breathing very heavily, making noises. It was just a real grumbly noise. He was just gasping for air and struggling to breathe, and it just continued and continued to get worse.
His kids were young. Just to play with his kids, he was just out of breath and couldn't play. And it was just such a different Steve than we remembered.
Despite his unrelenting symptoms, Steve still insisted on working.
I was just forcing my way through a day. I started talking to the guys and I thought, wow, you know, I think I should drive the truck. Driving the truck was a less demanding job than sitting in the back.
That was a hard thing for Steve to do, but a necessary thing at that point in time. As firemen, we like to be in where the action is.
I felt like I was letting the guys down. I felt like I was letting myself down. I was trying to work. You know, I wanted to go into work. I wanted to do my job, and every day it was just getting harder.
That's when it started to get real scary because that's not Steve. Steve's not the kind of person to take that kind of help.
I remember one day in particular when we pulled up on scene, everybody got out, went to the fire. I remember falling to my knees and trying to crawl my way up the truck. I was 33 years old. I'd always felt younger than my age, and I think at this point I felt like an old man.
At age 33, fireman EMT Steve Derrick was having trouble catching his breath. As his condition deteriorated, doctors prescribed a host of medicines, including steroids. But he wasn't getting better.
I would call the doctor, tell him all the symptoms. I think he believed me, but he was discounting it somewhat on the fact that, well, I was still going to work. How sick could I really be? At the fire station, I found myself putting the pulse ox on my finger.
A pulse ox, or pulse oximeter, measures the amount of oxygen in blood. A normal reading is 98 to 100, but Steve's was in the low 80s.
I would lay down on the bed, my heart was racing, my pulse ox was dipping. I would find myself in the back of the med unit, and the guys would hook me up to the heart monitor, and everybody was just shaking their head. Steve, you look horrible. You look worse than the patient we just brought in.
In a panic, Steve called his pulmonologist.
And at this point was the first time that he agreed. He said, Steve, I don't think you have asthma. He thought that I should see a cardiologist. There was a possibility that I could have a hole in my heart, and he wanted me to have the cardiopulmonary stress test to check for this. I immediately called Melissa, and I said, finally, he's listening.
He was so short of breath, he couldn't even have a conversation with me. And I realized we were kind of getting down to the wire. I called my brother-in-law and I said, "You need to take Steve to the hospital." And he said, "I was taking him anyway. He just collapsed in the driveway."
And I remember we stopped by my house and I said I just needed to go in for a minute, and I walked in the house by myself. I remember going up and walking through every room of the house. And I thought, this is it. I'm never gonna see this house again. And I knew I was dying, and I thought, this is it. I'll never see it again.
I had gotten a call from his internal medicine physician to ask me to see Steve because of his shortness of breath.
Dr. Schaub walked through the door, and I was just so relieved. I wanted to cry. I thought, he's gonna figure this out.
I reviewed his chart. His EKG was normal. I reviewed all the labs, and essentially everything was normal. Then I'm going, well, okay, let's think harder here. What's going on?
And I said, here's what happens. I said, if I would get out of this bed right now and walk to the door, I said, my oxygen saturation is gonna dip quite a bit.
And so I walked him through the hallway, and after approximately 50 feet, we're at 74%, which is significantly down.
And I said, are we gonna do the cardiopulmonary stress test? And he says, no, we don't need it. He says, you've already failed that test. We're gonna move on to the next one.
Physicians are trained to develop a differential diagnosis. In his case, he's short of breath. So you have to think, well, what are the things that can cause shortness of breath? But the usual things were looked at, and the usual things were not found. So we have to look for unusual things. And that was my approach when I evaluated Steve.
He was looking around the room, and he said, I've never really done this next test in the emergency room before, but we're going to do it right now. He said it was called a TEE, transesophageal echocardiogram. They would be able to determine from that if, in fact, I had a hole in my heart. And when the test was over, he said it did not appear that I had a hole in my heart, but the next morning they had scheduled a heart cath before they could completely rule that out.
Despite lingering questions about Steve's heart, Dr. Schaub began to suspect that perhaps they were looking in the wrong place entirely.
In my training, prior to becoming a physician, I was a paramedic. And I had an opportunity to obviously be sensitive to the exposure which a fireman paramedic can be in, meaning exposure not only to the toxic fumes of a fire, but to the blood and blood products that you are exposed to when you're at an accident scene. So I mentioned to him that I'd like to get in blood work that looks at not only inflammation, but also infectious causes.
By the time his blood was on its way to the lab, Steve's wife, Melissa, had reached the hospital.
When I got to the emergency room that morning, the cardiologist that they had called in met me in the room, and he said, your husband is very sick. We are going to try and figure out what's wrong with him. And he said, I just hope we can do it before it's too late.
The next morning was the heart cath test. It would give Dr. Schaub a detailed picture of the inside of Steve's heart.
One of the few things I remember about the heart cath is that feeling when the catheter goes into your heart, you can feel that flutter as it enters in.
The oxygen levels in all the chambers of the heart were normal. With that information, it almost eliminated the heart as a potential cause for a shortness of breath.
Dr. Schaub told us, a hole in your heart we can fix. He said, this is something else. And I got the feeling he wasn't sure that he could fix what this was.
I just remember being scared. I wouldn't say I was comfortable with the idea of dying, but I think at this point I was willing to accept the fact that maybe that was going to be the outcome.
I was talking to the phone to Melissa. She was home. She had just come home from the hospital, telling me how scared she was and asking me, how am I going to plan the funeral of my husband? I can't do it. So, sorry.
It brought me to my knees, and I said, I cannot live without him. I can remember praying and saying, I can handle anything it is, whatever it is. I just can't raise 2 children without my husband.
Thursday morning, when I saw Steve, I walked in his room at approximately 7 in the morning. He was the first patient I saw that day. He was on 100% oxygen. He had a temperature of almost 104 degrees, had a heart rate of approximately 140 beats per minute, and he looked at me and says, "I'm dying." I think he was.
Desperate for an answer, Dr. Schaub rushed to see if Steve's blood work was back yet.
I went to the hospital computer system, pulled up his name and his results, and on the screen was the reason for him being so sick.
Steve Derrick, a fireman EMT, had always been the portrait of good health. But at 33 years old, a mysterious disease is slowly killing him. He is unable to catch his breath and is in the hospital fighting for his life.
And I remember Russ and another friend of mine came in to see me that morning, and I could see the look on their face. They were concerned, they were worried.
Then a doctor came in the room and asked if we could please excuse him. He wanted to have Steve and Melissa alone and to talk with them.
They left the room, and the doctor shut the door, and I remember he took a deep breath. He was standing at the end of the bed, and he says, "I'm afraid I have some terrible news." He says, "You have AIDS." Couldn't believe it. I thought that was the death sentence. But he was confirming that I was gonna die. The only difference now was that we knew what it was.
AIDS, or acquired immunodeficiency syndrome, is caused by the HIV virus in the final stages of infection. The virus attacks the immune system, rendering it powerless to fight off infection.
Meaning you're getting parasitic infections, bacterial infections, viral infections that a normal body, a normal immune system would have easily conquered. But now, since you're unable to fight those viruses, those bacteria, and those parasitic infections, that now it's going to kill you. The environment will kill you.
Dr. Schaub now realized that Steve had PCP, a unique strain of pneumonia that often won't show up on a chest X-ray, but is the most common infection in people with AIDS. It was PCP pneumonia that had been causing all of Steve's symptoms.
My first thoughts were where and when. You know, it was the job. There was always exposures to blood. We were in a bad side of town. There were stabbings, there were shootings.
Unfortunately, paramedics have a 100% exposure chance to communicable diseases, AIDS being one of them.
He doesn't use drugs. He gets tested for drugs. He never had, committed any type of adultery, so it was just a clear-cut answer for us.
We realized immediately that Melissa needed to be tested.
Within a half an hour, they were drawing my blood.
We thought for sure, there's no way. If I had this disease, certainly I had given it to her.
The next few hours were excruciating for Steve and Melissa as they waited for the results of the blood test.
When the result came back, I just remember, we just cried. We were so happy that she didn't have it. And the infectious disease doctor assured us that if she didn't have it, it was impossible for the kids to have it. And it was the best news that we had heard in a long, long time.
After 6 months of searching, Steve finally had his diagnosis. But now he had to fight the infection that was threatening to take his life.
I started taking the drugs immediately to help with the PCP pneumonia. I remember the doctors telling me, "You're gonna get better, but you will probably get worse before you get better." I remember thinking, how can I possibly get worse than this?
Once Steve was diagnosed and treated, he was back to work in approximately 3 months.
Because of his HIV status, Steve had to give up his paramedic duties and become a full-time firefighter. And after a short time back on the job, he made a tough decision.
I probably should retire. going into burning buildings with my T-cell count, all the carcinogens that was breathing in, it just wasn't a very good place to be. When I did leave, at least I was able to leave the job on my own terms.
Today, Steve has his illness under control, but it will be a lifelong challenge.
If Steve had this infection 5 years ago, this disease would take his life. But today, because of the antiviral agents and the type of medications that we use, that Steve's prognosis is actually quite good. We now look at HIV as more of a chronic disease rather than a disease that takes lives.
Doctors are very optimistic. They tell me all the time, they think that if I can just stay healthy now, they said that at some point in time there's going to be a cure.
Steve's future looks good, but he still wonders how such a simple test slipped through the cracks.
Every test, your exam, your blood work, your x-rays, and the whole thing is just pieces of a puzzle that you eventually, as a physician, put together and attempt to form a picture of what the problem is. Is it perfect? It's not a perfect science.
Fortunately for Steve, one piece of his puzzle was Dr. Schaub, a former paramedic who knew what it meant to be an EMT.
He had told me, I know what kind of environment you work in. This is a test we need to do.
To be a firefighter, you have to be willing to run in when the other people are running out. They know that they're putting themselves in danger, and that's just what firefighters do.
In retrospect, there's nothing I would change. Is there a day that I don't know about that maybe I wish I would have had a cut covered up? Certainly, but there's nothing that I would change. If I had it to do all over again, I'd do it the same way.
Throughout his ordeal, Steve Derrig had the support of his entire firefighting community. But when illness struck 12-year-old Marissa Irwin, it was her mother who refused to take "we don't know" for an answer.
As a little girl, Marissa was very bold. She wasn't afraid of anything or anybody.
Marissa was a very bright, intelligent little girl who was always eager to be involved with whatever was going on.
But when Marissa turned 12, her mother Gail began to notice a disturbing change.
She started complaining of abdominal pain. She would vomit sometimes. She continuously was complaining about these stomach aches.
I would always go to school, and a couple hours later I'd get a stomach ache and my mom would have to come get me.
I didn't think anything of it. I just figured she was saying, I have a stomach ache, so she can maybe try and get out of going to school or something.
She kept complaining more and more and more. So finally I did take her to the doctor, and they examined her, and they said that everything was fine. There was no problem. Then a couple weeks later, she'd complain again, and I would take her back to the doctor, and they examined her and basically said that, everything was normal and everything was fine.
But for Marissa, things were far from fine.
She started also having headaches.
She would pretty much be immobile. I mean, it was just literally like somebody was just, sticking little needles inside her head.
I had taken her to the doctor for that, and he told me that he felt that she possibly had migraine headaches. He said that he would give her migraine medication and that, that would be fine.
They didn't help at all, and it was worthless.
Then, Marissa's headaches became more intense and were accompanied by dizziness. Concerned, Gail took Marissa back to the doctor.
I felt that some testing should be done just to make sure that there's no other problem causing these headaches. And it was at that point that he ordered a CT scan of the head.
Marissa's doctors said the scan showed no abnormalities, but Gail wanted another opinion.
Since I work in a hospital, I had asked one of the radiologists that I work for if he would look at it for me.
The radiologist noticed some slight bulging at the base of Marissa's skull, so he did Gail a favor and ordered an MRI. But the results were normal.
And so we just kind of forgot that idea and just kind of went on.
Still, the headaches and nausea continued to wreak havoc in Marissa's life.
She tried to continue to go to school, but she would get extremely ill, and I'd have to go pick her up and take her home. The teachers were getting very annoyed with me because they felt that I was catering to her. I felt like I couldn't worry about what anybody else thought. I couldn't worry about what the doctor said. I knew there was something wrong.
2 years, Gail Irwin has been searching for the cause of her daughter's mysterious illness. But she is no closer to the answer, and Marissa is getting worse.
When Marissa was 14, she started to have a sore throat. And I took her to the family doctor, who said that some of her lymph glands were enlarged. So the doctor sent her to an endocrinologist.
He found she had an inflamed thyroid, easily treated with medicine, but not the cause of her symptoms. Then the endocrinologist noticed something else.
And he noticed that my heart rate skipped every third beat. He immediately thought, you have to go to a cardiologist right now. So we went, and I started crying because I was scared. You know, I didn't know what was going on.
But once we did get to the cardiologist, he didn't think that it was a big deal.
The cardiologist felt Marissa's heart arrhythmia was simply causing her to have abnormally low blood pressure, and that was the source of all her problems.
He said that if you take these high doses of Sudafed and caffeine and salt, it will increase her heart rate, which will increase her blood pressure, and she'll be fine.
Well, I was on caffeine 24/7, so with the diet, I was kind of bouncing around everywhere.
She got worse. She started complaining more and more of the pain in her head.
Gail was desperate, so she found a new cardiologist, hoping he might be able to solve the mystery of Marissa's symptoms.
That cardiologist confirmed that she did have problems with her blood pressure, but he didn't feel that she should be on all this salt and caffeine.
What he thought was that Marissa had POTS, postural orthostatic tachycardia syndrome, in which the mere act of standing up causes the blood pressure to plummet and the heart to race.
Basically, all the blood which should be being pumped up to your head was pooling in her legs.
To treat the symptoms, the doctor put Marissa on prednisone, a steroid that can help elevate the blood pressure.
Well, when Marissa was on the high doses of prednisone, we were concerned. She actually developed what's called moon face, and with the very chubby cheeks like a chipmunk.
She got so swollen and was retaining so much fluid that the doctor thought it best to take her off of it.
The swelling eventually went away, but Marissa's dizziness soon turned into full-blown blackouts.
Many times Marissa would start to feel ill when she was in her classes, and she would ask to go to the restroom. Once she got to the restroom, she would pass out, and sometimes the teachers or the other kids would find her there.
I missed about half of the school year in 9th grade. I missed like a month of 10th grade.
The school finally started to feel that she was kind of a liability, and so they started sending a tutor to our home to help her get through her classes.
So I was homeschooled till I graduated.
Marissa's friends began to stop calling. They stopped asking Marissa, to come over, to go out, or anything like that.
Marissa was becoming very depressed. She felt that everybody was abandoning her. She just would say to me, "I have no life."
Stuck in the house, Marissa started to deteriorate even further.
She's constantly tired. She's having a hard time staying awake. She's sick all the time. Her body just started to lose what little strength it already had.
I couldn't do anything. I could barely walk to the kitchen. That was only 7 steps. So if I'd have to walk like a distance, I'd have to be in a wheelchair.
I thought somebody needs to do something. I didn't know what it needed to be, but she's just kind of like wilting away, and I didn't want to lose my sister.
Sometimes when I would get really emotional about how I'd feel or what was going on, I couldn't say it out loud. So I would write letters to say whatever I was feeling, just to get it out.
Mom, I know for a fact that if it wasn't for you, I wouldn't be here, and I want you to know that. Thank you for trying to help me, Marissa.
Marissa Irwin was a healthy and happy little girl. But at age 12, she began to have crippling stomach aches and headaches. Now at 15, she can barely walk, and she's unable to go to school.
Marissa, at this point, had severe headaches, I would say probably 80% of the time. And she walked usually about 10 to 15 feet. If she didn't pass out, she would at least have to go down on one knee because she was severely dizzy.
I would just get so exhausted and my head would start hurting again, so I would be in a wheelchair.
Horrified by Marissa's downward slide, Gail kept trying new doctors.
I didn't go anywhere. I mean, the only places that I went were to doctors.
Most parents were taking their kids to soccer practice and tap classes and ballet, and I took her to the doctors.
But no doctor could give Gail the answers she was looking for.
One doctor did tell me that I needed to accept the fact that my daughter would live in a wheelchair for the rest of her life. I wasn't willing to accept that.
Determined to save her daughter, Gail searched the internet, hoping to find a clue.
I came across a lady who had trouble maintaining her blood pressure. She eventually had an MRI, and they found that she had what's considered a Chiari-1 malformation. When I looked up what that was, it talked about how the very back portion of the brain herniates into the neck. And she had surgery, and all of her symptoms were gone, and she was fine.
Remembering the slight bulge that the radiologist had seen on Marissa's MRI 2 years earlier, Gail wondered, could this be the same thing?
So I went back to that original radiologist and asked him, could you look at it again? And he basically drew a line at the bottom of the skull, and he said there should be no brain matter below this. But on one of the images there was, but he said it's so small, it shouldn't cause a problem. So then I started doing research on neurosurgeons.
Gail made appointments with several neurosurgeons who might be able to determine if indeed that small bulge could be the sign of something more serious.
One neurosurgeon was very kind. Basically, he said, I see what you see on her scan, but I really don't know if surgery would help her.
She would reassure me that we would find a doctor that would help me.
I think Gail tended to put on a good front in front of her daughter, in front of Marissa. I think that Gail knew that there was something going on that wasn't right.
Part of my mind said that how could all these people with so much knowledge tell you that there's nothing wrong with her, and you think that there is something wrong with her? But at the same time, if there was an answer out there, I just felt that I had to find it, even if everybody else did think I was a little nutty.
Gail got back on the internet and found a Chiari-1 website. The more she read, the more convinced she was that her daughter had a Chiari-1 malformation.
And I started reading all of their emails, and a lot of the people had talked about Dr. Bolognese and Dr. Mellorat and the Chiari Institute on Long Island.
I told her, if you think New York has a specific clinic for the problem you think she has, why don't you just go to New York?
Within a week, Gail and Marissa were on their way to meet with Dr. Bolognese.
Well, first of all, he's Italian, so he has this thick Italian accent, and he is very friendly.
I remember this skinny little girl coming through the door, and with a shy smile. And sure enough, a couple of feet behind her, there was her mother. They were always together, like part of one whole ensemble.
He's like none of the other neurosurgeons that we met. He's very calm. He explained everything to us.
Typically, all of our patients come to us and they stay with us for a period of 2 days. During those 2 days, they get analyzed from top to bottom. We do several tests. We do a neurological exam. We do a bunch of different MRIs.
He felt that possibly she had a Chiari-1 malformation, but he couldn't really tell.
I knew that some of the symptoms were typical of the disorder we treat, but not all the boxes were checked.
Chiari-1 malformation occurs when the skull does not have enough space to accommodate the brain. The brain gets squeezed out of the large opening at the base of the skull and down into the spine. The increased pressure within the brain can cause headaches, numbness, dizziness, and nausea. Left untreated, it can evolve into paralysis.
There were actually some features of an anatomy on the MRI that didn't fit with Chiari-1 malformation at all. At the same time, her joints were very wobbly. She was having a condition called Ehlers-Danlos syndrome. It is a disorder of the connective tissues. They are the tissues that allow us to do this kind of tricks or for the contortionist to be famous in a circus.
But Ehlers-Danlos didn't explain all of Marissa's symptoms. Then Dr. Bolognesi noticed another abnormality.
He also said that she had a retroflex odontoid, the small piece of bone that allows your head to rotate instead of being pointing upwards or out a little bit, was pointing backwards.
The head tends to sag down over your spine and is pushing against the anterior part of the brainstem.
Because of the weakness in her tissues brought on by the Ehlers-Danlos, Marissa's neck wasn't supporting her head sufficiently. So the odontoid bone at the top of her spinal column was pressing into her brain. The tests told Bolognesi a lot about Marissa's condition. She showed signs of several different disorders, Chiari-1, Ehlers-Danlos, and a retroflexed odontoid. But there still wasn't one clear diagnosis.
At the end of the consultation, we decided to give Marissa some schoolwork. We were not going to dump her because she was not going to satisfy all our check boxes.
He wanted to do more testing, and I was just almost relieved that someone was at least willing to take steps to see if they could find a reason for all of these symptoms.
In an effort to relieve the pressure on Marissa's brain, Dr. Bolognesi wanted to try putting Marissa in a temporary traction device.
He sent us home with a prescription for a cervical collar. Whenever we would go out anywhere, I'd put her in the collar. Dr. Bolognesi also ordered a over-the-door traction unit, and he told her, whenever you're feeling real bad, just see if this will help. She was just shocked the first time. Within 10 minutes, all the pain in her head was gone when she was in traction.
They gave me hope. They gave me faith that he could actually help me. He was the one that was going to help me.
After Marissa and I saw that there were good results, Dr. Bolognesi asked us to come back to Long Island.
After some additional testing, Dr. Bolognesi felt that the only remedy for Marissa's constant pain was surgery, brain surgery.
And we said, we have a surgery which can reproduce the same effects of the traction in a long-term fashion.
Marissa was very scared when they told her that she had to have surgery. I told Marissa that we've been down this long road, and if this is the answer, then you have to take it.
After 5 years of misery, Marissa Irwin has finally discovered that her mysterious pain and paralysis is being caused by intense pressure on her brain. Wheelchair-bound and in agony, her only hope is a rare and dangerous surgery.
Marissa was nervous, but she was not losing her smile. All the people in the room were very touched by her.
My whole body was shaking. And my doctor, Bolognesi, and Dr. Millerat came to me and said, you know, it's okay, it's all right.
It's actually a pretty rare surgery for neurosurgeons. The operation is pretty dramatic.
First, the doctors would have to reposition Marissa's skull so her odontoid bone was no longer pressing on her brainstem. They would then have to fuse the vertebrae and lock the spine in place using specially designed surgical screws. One wrong move, and Marissa might be paralyzed for life.
We try to reproduce down to the millimeter the only position in which the patient feels comfortable, because we want to freeze that for the rest of their life. The main part of the operation has some components which are nerve-wracking. You know that with the trajectory of some of the screws, you can pretty much end the operation there, and that is very stressful.
Originally, I was told that the surgery lasts about 5 hours. So I don't know, I just innocently thought that at 5 hours and 15 minutes, he would be out to talk to me.
So when the 6th hour came by, my mother was really starting to get upset.
I was just beside myself.
But there was good reason for the delay. When the doctors opened up Marissa's skull, they discovered that not only was her odontoid pressing into her brain was being squeezed down into her spine. She did have a Chiari-1 malformation after all. Now they would have to perform 2 operations.
We decompressed the Chiari-1 malformation with a minimalistic approach to the problem. And we corrected the compression between the brainstem and the odontoid by extracting the head out. 2 surgeries in 1 package. We were satisfied. And with that kind of feeling, we went out to talk to Marissa's mom.
Dr. Bolognese came out and said that everything went good and that he was, very pleased with her results. Her sister and I just cried and laughed. Then we ran downstairs and made phone calls.
When I first woke up out of the surgery, I remember being in a lot of pain.
The operation was entailing a lot of dissection, which is medical lingo for we cut you open and we cut you deep. She was in pain for quite some time.
When they told me I could go home, I was really relieved. And they took out the staples and the stitches, and I started crying because, they basically saved my life.
The dangers of surgery were behind her, but now Marissa had to face the struggle of a long recovery.
When Marissa was still recovering, one time she made the remark to me that she was so ugly now, from being cut and from the surgery.
I didn't look in the mirror very much because I felt kind of like Frankenstein.
Once her hair grew back, Gail convinced Marissa to take some professional photos to remind her that she was beautiful and to boost her self-confidence.
She went and had the pictures taken, and I got a phone call from a lady that said, these pictures are really good, and I really think she could have a career here. And so since that time, she's been signed by a modeling agency in New York City.
Now being involved with modeling, she has a real spark to her eye, which she had lost there for a number of years.
Without her mother's determination to find an answer, Marissa could have spent her entire life in a wheelchair and in constant pain.
In the case of Marissa, the MRI was not enough positive enough, not enough strong enough to declare the diagnosis from the start.
Most people, when their brain herniates, it herniates in the middle. In Marissa's case, it went out to the side, and so that's why we had such a hard time finding a diagnosis. Even though a Chiari malformation is thought to be rare, this was even more rare because she didn't do it by the textbook.
It was a very long journey. 5 years is a long time, especially when your daughter is deteriorating in front of your eyes. And in the case of Marissa's mom, she was a fighter, and she didn't pull any punches in the process.
Many times people with a lot more book knowledge told me that I was wrong. And it would have been easy to have stopped and thought that you'd done everything possible, but I felt that there was an answer out there that I had to find.
She would never give up. I didn't go through it alone, and she was always there.